Welcome to the module Clostridioides difficile, Prevention, a Frontline Forces Training presented by Superior Health Quality Alliance or Superior Health. This learning module was developed for direct caregivers working in multiple healthcare settings who care for a variety of patients. It is also relevant for family members caring for a loved one in the home. Direct caregivers play a very critical role in providing care to individuals in many settings of care. Why? Because direct caregivers spend a great deal of time with their patients, which helps them to know and better understand the needs of these individuals. The purpose of this course is to further your learning and build on your current knowledge about preventing Clostridioides difficile, or CDI. You may also hear this referred to as C. difficile or C. diff. What you know and how you use that information improves the quality and the safety of the patients you care for. This learning module, Clostridioides difficile, Prevention, is the second of a two-part series of modules that explores the important role direct care staff have in both the recognition and prevention of Clostridioides difficile. You are viewing the second module of the series, which provides a general overview about the prevention of Clostridioides difficile. It is not necessary to complete the entire series of modules in one sitting. You can leave and return to any of the modules at any time. The learning objectives for this module include review important healthcare strategies to prevent CDI and explain next steps when you suspect CDI. CDI is highly contagious. Clostridioides difficile, or CDI, is highly contagious and can be spread to others very easily. The bacteria found in the stool can be spread through touching infected objects, poor hand hygiene practices, and putting contaminated hands into the mouth. The spore-forming bacteria can live on surfaces for several months. Prevention is a very important key in preventing the spread of infection. Prevention, hand hygiene. Healthcare staff should use soap and water when a person is suspected of having CDI. Only soap and water will kill the bacterial spores. Healthcare personnel should complete hand hygiene immediately before touching a patient, before moving from work on a soiled body site to a clean body site on the same patient, after touching a patient or a patient's immediate environment, after contact with blood, body fluids, or contaminated surfaces, and immediately after glove removal. Prevention, personal protective equipment, or PPE. Wearing the appropriate personal protective equipment, referred to as PPE, helps prevent the spread of CDI and protects other patients, visitors, and staff. This PPE includes gowns, gloves, an eye cover if appropriate, and a mask. Gloves and gowns should always be worn when caring for a person with CDI. Prevention, environmental considerations. Patients, whenever possible, should have a private room with a private bath. The patient should only use the private bathroom while they are on contact precautions. In circumstances where there's a private room with a shared bathroom, move the patient to a private room if possible. The patient with the active CDI should use a separate toilet, such as a dedicated commode. Prevention, environmental considerations continued. In circumstances where there's a shared room with a shared bathroom, perform hand hygiene and change personal protective equipment between each resident. Maintain a minimum 3-foot barrier between living spaces. Use a privacy curtain or tape on the floor to emphasize the physical separation between the two patients. Patients with active CDI should use a separate toilet, such as a dedicated commode, while a resident in the room is on contact precautions. Use commode liners whenever possible. Immediately clean and disinfect the commode or toilet and armrests and grab bars after each use. Prevention, cleaning and disinfecting. It's very important to use dedicated equipment during care of patients with suspected or actual CDI to prevent the spread of infection. That could include equipment such as stethoscopes, blood pressure cuffs, lifts, and slings. Clean and disinfect high-touch areas in the patient's room, such as tray tables, wheelchairs, call lights, and light switches. Clean and disinfect patient equipment after each and every use. Use the correct cleaning and disinfecting products. Refer to the manufacturer's directions for use. Change of condition notification. Notify nursing staff promptly whenever you observe any of the following: fever, diarrhea or loose watery stools, nausea, blood or pus in the stool, abdominal cramping or tenderness. Reporting these symptoms can lead to early treatment of CDI and reduce the complications from occurring. Congratulations, you have successfully completed this module. It is now time to test your knowledge by taking the quiz. Click on the link for the Clostridioides difficile prevention quiz on the Frontline Forces webpage or in the YouTube description below. For further information, we've compiled a list of resources or references about Clostridioides difficile. This material was prepared by the Superior Health Quality Alliance, a quality innovation network quality improvement organization under contract with the Centers for Medicare and Medicaid Services, or CMS, an agency of the United States Department of Health and Human Services.